Hi, I'm Dr. Brian Thornburg, and I wanted to redo the alternative vaccine schedule that I have provided in previous videos. Now that I have 3 minutes on Instagram, a brand new studio to do lectures, now I can start to post on YouTube. I thought this would be a great time to kind of restate and refresh with all the new parents that are following on how to look at vaccines. So the CDC, the American Academy of Pediatrics, the American Academy of Family Practitioners have a vaccine schedule that we follow here in the United States. But every industrialized country, basically all of Europe, Japan, and certain other countries around the world, they have vaccine schedules, but they differ from that of the United States. Their epidemiologists, their PhDs review the same literature, the same scientific literature regarding vaccines, and they decided that there should be differences to their vaccine schedule for their population compared to that of the United States. And it's not that they have different science, as I said, we all use the same science. What's important to note here is that we use our culture to interpret the science. Medicine is a combination of science and culture. The science is interpreted through a cultural prism, and that's how we derive our medicine. There's a great book by Lynn Pear. I believe it came out in 1991. I'm not positive, but it's right around that time. And the title of the book is Medicine and Culture. And what she shows is that in the four top industrialized countries, United States, Great Britain, Germany, and France, common adult illnesses like hypertension or high cholesterol are treated different in every single one of these countries. And what is practiced in one country as a standard of care is malpractice in the next country. So we can see that medicine is long rooted in a cultural interpretation of the science. We can even see this in a more recent modification of how we are now interpreting the COVID vaccine as unsafe, whereas 5 years ago, the popular narrative was that it was safe. So we can see that there can be politicization of the culture, and that's what we want to get away from. So returning to the story of how to look at vaccines, every industrialized country has a different vaccine schedule because of the culture interprets the science differently. And when I discuss this with my families, say you're doing the same thing. You have a certain culture that you grew up with. There's certain experiences that you have that heavily influence how you make your decisions for your family. It's not that you're unscientific, just you've had different experiences, and therefore you're going to interpret it through a different lens. And when it comes to vaccines, since all of these westernized countries can pick different vaccine schedules, for instance, until recently, Great Britain did not have a chickenpox vaccine. It was very difficult to find one in the country. It is now easier to find a chickenpox vaccine in that country, not required to go to school. 75 to 80% of Europe does not require a vaccine immunization form to present to the school. They do not ask the families what vaccines your child has had. They just accept the child right into school. So again, there's this cultural prism that we're using. But getting back to the story at hand, each family has the same right to have an interpretation through their culture. And this is where I come in, and I make sure that the family is doing their homework now, because whether you vaccinate and there's a problem or you don't vaccinate and there's a problem, the moment prior to the event that's a problem is your homework time, because we never know if there's going to be a problem. And hopefully there's not a problem. And fortunately, most kids who take vaccines do not have problems. As we measure this at this time, we don't know what's happening years and years down the road. And most children who don't vaccinate don't contract vaccine preventable illnesses. So it seems somewhat of a wash. However, it is important to note that over $3 to $4 billion has been paid out to families whose children have been vaccine injured by the vaccine court. The vaccine court is a special judicial area branch who has special knowledge in vaccines because it's a very complex topic. And they have decided that, I don't know what the current number of vaccine injured children is that has been awarded money from the vaccine court, but suffice it to say that it has been $3 to $4 billion since the inception of the court in 1986. So there are certainly injuries occurring from vaccines. Similarly, if you don't vaccinate, there can be a vaccine preventable disease that your child contracts. But going back to the culture, medicine, and scientific analysis, I tell my families, if your culture says that you need to have security from following the CDC vaccine schedule, then by all means do, and about a third of my practice does this. Another third says, well, not all the vaccines have the same weight. Baby's not going to go out and have sex anytime soon. So therefore, hepatitis B is not as problematic as, say, strep pneumo meningitis. Strep pneumo happens in about 1 in a million children, and hepatitis B is far less than that. So parent would stratify the different vaccines based on their incidence or severity or frequency, and then they will cherry pick the vaccines depending on what their culture, and again, working through science and creating a medical path for them. So I look at vaccines as asteroids hitting the Earth. Those are the vaccines that are available, but very unlikely to have a problem like hepatitis B or polio at these newborn through 1, 2, 3, 4 years of age. Hepatitis B most likely is going to come from sexual contact. It can also come from IV drug use with unclean needles, as well as tattoos with unclean needles. And very, very rarely, and I just want to mention it, the idea that your child and another child are going to cut themselves at the same time on the football field or on the wrestling mat and then mix blood, that is such a pigeonholed argument. It certainly can't carry forth in this argument, in my opinion. After asteroids hitting the Earth, we have plane crashes. Plane crashes do not happen often, but almost nobody walks away. These are the meningitis vaccines, so this is going to be Prevnar and Hib. There's a 1 in a million to 1 in 2 million chance that a child can contract these diseases, 50% chance of neurological problems for the rest of your life if you contract one of these diseases, and that 50% chance of neurological problems for the rest of your life can include death. So it's a very serious disease and not to be taken lightly, but the frequency of it is very small. Then the last, we have what I call car crashes, and car crashes happen every day. Almost everybody walks away from their car crash. A few people do not walk away from a car crash. So your car crashes are going to be rotavirus vaccine, DTaP vaccine. I'm leaving one vaccine that is recommended at this time out of this list, and that is the RSV vaccine. I've done a whole 10-part series on the RSV vaccine for infants, and that is a hard no. Go back and look at my 10-part series. I timestamp the entire lecture with the minutes that are available on YouTube from the ACIP meeting notes, which means you're hearing it directly from those doctors who vote to have that vaccine added to the childhood schedule. And I, for the most part, destroy any semblance of a rational argument that they have. And it's not even a difficult task to do. As I say in the video, a first-year medical student would do a better analysis on that scientific analysis compared to what those esteemed doctors, PhDs, did. It's really tragic that that vaccine is on the schedule. I have those families who will decide to cherry pick, and they will use the stratification as a way to help decide, starting at 2 months when the vaccines start, if they want to do all or some or none. That would be the third group, the group that does none. And the group that does none, they choose not to vaccinate because the body's detox pathways are not fully matured. The kidneys do not fully mature until 2 years old. The liver is not considered mature enough to handle Motrin until 6 months old. That's how we eliminate our toxins, through our kidneys and through our liver. And if those pathways aren't working and we're giving shots at 2 months old, 4 months old, and again at 6 months old, plus all the other shots before 2 years old, then that makes it a difficult task for the body to eliminate because the pathways aren't working that well. Additionally, the immune system is not fully matured, and I make that argument for two reasons. One, an allergist will not see a child for allergic reasons until they're 2 to 3 years old, because if they draw labs on that child, the labs are not consistent enough to make medical appropriate decisions from, because the immune system's immature and therefore the labs are not consistent. So if we're asking the toddler's body to process vaccines to build immunity, yet the system that is to be used, the machinery, is only partially working, you can see how that would be a difficult problem and could result in difficulties. The second reason, the body can do more with fewer vaccines if we wait till they're older. If we start the meningitis shots, Prevnar and Hib, at their CDC recommended times, 2 months, 4 months, 6 months, 12 months, or 15 months, that'll cover 4 shots in each of those 2 vaccine series. But if we give the Hib, instead of having to give 4 shots, if we give the Hib at 15 months, you give 1 shot and then they're done. For Prevnar, instead of having to give the 4 shots in the series, if we do it according to the CDC, you only have to do 1 shot at 2 years old. So you can see, if you reverse engineer, that the immune system's not fully mature until an older age. So why are we giving the vaccines? Because we just have to give additional toxins to help mount an appropriate vaccine response. I make an analogy that's like trying to teach your 4th grader geometry. You have to present it more and more times because they can't get it. But if you wait until 9th grade, 10th grade, then they get it on first pass. Those parents that then choose to delay the start of vaccines do so after 2 to 3 years old. They may overlay the stratification of the vaccines on top of that, meaning they're not going to give hepatitis B until the child's a teenager. What I didn't mention before is hepatitis B given at birth. This series is generally concluded by 6 months to 9 months old. But we know in 50% or greater of those recipients of the hepatitis B vaccine, they lose the benefits of the vaccine 10 to 12 years out. That means by the time that child is a teen, when they're going to more likely engage in sex, drug use, getting a tattoo with an unclean needle, is in those teen years. Now more than half of them don't have hepatitis B protection because the vaccine is expired. Again, another reason that you might want to look at the current CDC schedule with a cultural lens that's more appropriate for you, and make sure you find a physician that helps you do your homework. So if, God forbid, anything was to happen to your child, you knew in your heart that you did the best you could for your kid prior to that. And you are a good parent if you have a different view on vaccines and have done a scientific analysis. Thanks for listening.